Good morning, everyone. Now, from this episode on, we will shift our focus again back to the child-related issues. And we are going to today look at attention deficit hyperactivity disorder. So, generally, this attention problems or hyperactivity generally below 5 years age, they are usually considered to be like they are growing up children, and it's normal that they are like this, jumping all over the place or not able to concentrate. But then if you look at more carefully at the behaviors of these kids, generally it is more in boys, and it is seen in 1 in 100 primary school children. Generally, most of the signs related to this hyperactivity, if the parents are carefully observing, we can look at, at the toddler age, between the 3 to 5 years age, where most of the symptoms starts, and more so after 5 years. So if you look at how can we identify what are the signs and symptoms where you can identify this hyperactivity, attention deficit hyperactivity, popularly known as ADHD. So here, generally kids are, all over the place, always as if they are running like a motor. They cannot sit constantly in one place, and they might intrude in the adult conversations, or completely, continuously fidgeting, unable to kind of sit in their seat, or for that matter, any activity that requires them to sit. These kids will be very restless, and then they move all over the place. Disorganization is another problem, where finding the things and organizing them when before doing an activity. Organizational problems can be. So mainly when you look at the symptoms, there are 3 set of symptoms. One is impulsive behavior, the other one is hyperactivity, and the third one is inattention. So the details of how one can make out the behaviors of children with these 3 sets of symptoms, I've given in the form of slides at the end of this video, which will explain you how you can look at the different behaviors which indicate the specific symptom of the attention deficit hyperactivity. So mainly they have difficulties in taking their turns, and then they usually interrupt the adult conversations, and then they kind of not complete what they have started, and then they get bored very easily. Is there a problem with the intelligence? There is no problem with their intelligence. Most of them are on average, or some of them are even above average in intelligence. So here the problem is not with the intelligence. The problem is mainly in attention concentration, and then there is an increased activity that is interfering with the task, and then there is a problem of impulsive behaviors. So these are the indications of hyperactivity in children. And then looking at the causes, generally the specific pinpointer of this hyperactivity is not very clear, but there are genetic possibilities, parental or close family member, especially the primary caregivers, having some possibility of this genetic vulnerability. And then there is a neurological theory which indicates some neurological dysfunction, especially in the frontal lobes of the brain. So these are some of the possible factors or causes so far that we have access to. Looking at how do we manage this, there are two levels of management here. One is the medical or psychiatric management, and the second one is the psychological management. So looking at the psychiatric or medical management, especially kids having a severe hyperactivity. So how do we say it is severe? Generally, a detailed assessment of the parental as well as teacher scales and the observation of the child with specific assessment tools where the children are categorized as having mild to moderate to severe hyperactivity. Mild to moderate, to some extent, we can start working with a vigorous behavior modification, like an early intervention program. As soon as you identify the parents, bring them to the notice. Generally, like I said, as early as toddlers, you can make out that there is something different from these children if you observe carefully. So here, severe kind of conditions definitely require medication. The role of medication is mainly in improving the attention and concentration for a brief time. During this period, usually the kids are, their academic performance is better, and then they are in par with the other peer group. But the medication part is a short-term course, and then during this period, a simultaneous behavior modification program or behavior therapy program from a clinical psychologist or a child psychologist will be more effective in order to modify their behaviors. So to sum up, that the medication is mainly for helping the attention and concentration, and it is mandatory in severe hyperactivity children. And then as they are more cooperative with the medication, a behavior modification program should be in place. So looking at the psychological management, it is at a multiple levels. Starting with the parental education, mainly the parents are given the background as to how they can identify what are all the behaviors that indicate this hyperactivity, attention deficit hyperactivity, and then a little bit working on the environment. We call it environmental modification, a calm and quiet environment. Some of the parents are of the opinion, maybe they're not listening to us, so a physical punishment might work, or keeping them in a boarding school or in a hostel make them more independent. You know, these kind of thoughts were expressed by the parents when they are approaching us in our day-to-day practices. But to tell you very frankly, these children need an extra time of you, and then you need to be spending more qualitative time, and the behavior program that is given by the child psychologist need to be implemented by the parents at home in their natural setting. So sending them to a hostel or putting them into a boarding kind of setup or putting them in the care centers is not going to be the solution for these children. Kindly, the parents need to be kept all these points in mind. Looking at the behavior modification program per se, here based on the child's age, the behavior modification program is being developed. So the main principle in the behavior modification program being all behaviors are learned behaviors. So the behaviors that are undesirable can be hence unlearned, and then the behaviors that are desirable can be relearned with this basic principle. Working with a conditioning principle, the behavior program is tailor-made according to the age of the child, according to the activity level of the child. So here the focus is mainly on helping the child in developing a program where there are activities that help them to enhance or improve their attention span, and also help them in persistence of the task that they are supposed to be completing. So there are attention enhancement tasks that are given. These are the scientific kind of activities that are being well established that will help them to improve the attention span and sustenance of the attention. So attention enhancing activities, and then there are activities in order to reduce the undesirable behaviors. We call it token economy program. By introducing a reward system, the parents are involved into the program where there is a list of undesirable behaviors, and then how by using a reward system, how the child can be, the behaviors, undesirable behaviors can be modified is what is planned in collaboration with the parental, in cooperation with the parents. So hence the program need to be carried out at home. The involvement of the parents is a must if it is a 10-year-old or below 10 years children. And then a kind of working out on their improving on their impulsive behaviors. Some of the children are, most of the times, as part of their symptomatology, they usually do the activities very impulsively without foreseeing the consequences. So art therapy is one important area where through art therapy, the child can be helped through, improving this aspect of impulsive behavior, where the child is helped in be able to look at more meticulously at the environment, because most of the times the details of the environment or the details of the activity is missing because of their child tendencies of being less attentive to the details. So art therapy helps them to look at more, into getting into more details and how to persist with the task and complete the task. And to say you, most of the children enjoy the art therapy while it is helping them to improve their attention span as well as their giving a vent to their impulsive behaviors. So looking at how effective in the long run, what happens to these children in the long run over years, almost 70 to 80% of the children with effective early intervention program detected as early as 5 years, 7 years, can go, or they are in par with their other peers, and then they are able to catch up with their academics, and they are able to move on with their normal life course. But it is also important to note that usually the hyperactivity, and generally the severe kind of hyperactivity, needs a long-term care, many years of help. And some of them, around 15 to 20% of them, the hyperactivity can move on with the adulthood. And then if they are not treated, or if it is not been addressed, there are other possibilities of getting into conduct disorders or learning disabilities and problems with the teenage antisocial behaviors. There can be these kind of secondary issues, and impulse issues or anger control issues can also be one of the important area to be addressed, especially in the pre-teens and adolescents. So these are based on when they approach for the treatment. The earlier, always, for any psychological condition, I told in the previous videos also, whether it is an adult or a child, the earlier the intervention or treatment, the better it can be improved. So this is all for today, and hope this short video will be helpful to the teachers as well as the parents to help their children identify at the earliest, and then take care of them both from the medical as well as psychological perspective. Thank you all.